I got a email sometime earlier this week from a chaplain, and I'm trying to remember now where she's from, but she's moving here. Her husband got a job here and they're moving. And so she's trying to figure out like what she's going to do when she gets here, right? But I pointed her to, she hasn't moved yet. I pointed her to though all the recordings in Sacred of At the Intersection. And I said, if you have time and before you get here, I think a great way to kind of get yourself introduced into what is happening in San Antonio and knowing people, especially at the intersection between, faith and society. And I said, you just go and listen to those recordings and you'll get a rhythm to it. You can fast forward from good morning, it's 8 o'clock at the intersection, which it is, and announcements and things. But I think the beauty of what we've co-created here is that, you can get, if you figure out the rhythm, you can get that 10 to 15 minutes of something that's happening. And I think we've got more than a primer for folks here in San Antonio in those recordings. Great way for people to move here who want to do similar work. Could even be a study within, where you serve or your organization, where you just pull out the 15 minutes of whatever the context is and utilize that in terms of team development, strategies. And so I do think that we have developed something together on Thursday mornings for these last 3+ years.
Northern Gaza is on the brink of official famine.
Good morning. I never know who to respond to when things like that happen. Boy, Scott, did you not go to yoga this morning?
We did, but we started Shavasana 5 minutes early.
Oh, well, there you go. Look at you. What a planner you are. So good morning, everyone. It is 8:01, and we're just going to take a couple minutes of announcements to help other people get into the screen so they can hear Scott's briefing this morning. Does anybody have announcements that they'd like to share? Wow, they're just popping out like crazy today. So some announcements that I can think of in May 18th. So I'll put that in chat, but May 18th, it's a Saturday. And during the day, TEDx San Antonio is going to be doing a TEDx. It's where people come and they share their stories, their ideas. And the ideas this time are around compassion, community, and care. And I heard from the TEDx local organizers that they had 290 applications to speak at this TEDx globally. They had people apply from all over the world. I'd like to meet all 290, right? Who are these people? And that want to talk and are talking about compassion and community and care. But there are 7 speakers who will be with us in person that day. I want to say it's like 9 to 2. And I will see if I can find the link and put that in chat. There is a cost, there's a ticket. But I really want to invite you all to come. I think it would be a great place for many of us to meet that day. If you've never been to a TEDx, there's a speaker and they're always amazing. And then there's like a break and then there's a speaker and they're amazing. And that kind of repeats itself and there are breaks, but it also gives opportunity for people who are gathered there to meet together and share what they're thinking and planning. The one I went to last summer, which was on the environment, which just blew me away. A lot of this work, the TEDx this time, came out of that gathering last summer. So again, I encourage you, if you can, to attend TEDx San Antonio, May 18th. And I'll get that link in the chat. Another thing that's coming up May 8th, and correct me if I'm incorrect, but let's see, sacred.org has an event, a gathering, 8 a.m. to noon at the neighborhood, what's it called, Billy? I want to say center, but I don't think that's right. Might be right.
Neighborhood place, I believe, right, Bill?
That's it. It didn't sound quite right. But it's going to be on mental health and resourcing in particular. How do we collaborate more so in our city? And Bill Neely's there. I'm just going to let Bill Neely do his spiel. Go, Bill.
Yeah, so it's a morning session. It's going to be all about mental health resourcing. And so we'll have a couple of panels. We're going to have a group from speaking about mental health resourcing and how they are assisting school-aged people, so from school age up to college, university students. We're going to have a panel on that, and then we're going to have a panel on community-based organizations that are helping navigate their neighbors into mental health services. That is primarily going to be Bridges to Care and the new community congregational collaborative that the Ichiba Foundation is putting on. And there we'll be talking about adults through seniors and older adults on their needs. And so it's all about all the initiatives that are taking place through both organizations, nonprofit agencies and schools, as well as faith-based and community-based organizations. So it'll be great. 8 to noon. Anne's going to wrap it up with a community conversation designed to spur us all into action for when we leave. So it'll be a great event, and there'll be tacos and coffee. So make sure you come to that. And I have to shout out that CHCS is very generously helping to sponsor some of the costs. So make sure you come. 8 to noon, May 8th at the neighborhood place on Rivas on the west side, and we'll be sending out a sign up and registration shortly. So in the next day or two. So
if you have a link, you might not, but if you have a link, you might want to put that in chat.
There's no link yet, but there will be, so soon.
So we're going to head into our briefing, and so I'm kind of helping Scott out here just so he also knows what we've been doing at the intersection, which started right at the beginning of the pandemic. Our first time together was April 30th. And so here we are, April the 11th, but April 30th, 2020. So we've been meeting on every Thursday except Thanksgiving for these 3 years. But we have been talking in various ways about how we heal as a community, and even more so post-pandemic. So this was one of the collaborative actions that have come out of our mutual work here at the intersection. And this doesn't sound like neuroscience over here where it says 10 steps to healing as a community, but it's from all the neuroscience and how we heal as a people together, especially when we've had collective trauma, how we've gone through like the pandemic together, people who've gone through war together. And this relates to what Scott's going to be sharing with us today in terms of housing. But I thought I'd kind of show you things that we all can be doing to help San Antonio, our congregations, our organizations to heal. None of it is rocket science. It's human science about creating spaces, listening and naming, building relationships, noticing what's really going on in our bodies, breathing, outdoors. Humor is a great one. You take in lots of oxygen when you laugh. Recognizing our togetherness, this coming together every Thursday morning, what's going on inside of us, what's going on outside of us, and that knowing that being, thinking, feeling together, that's what creates community. So now I want to introduce my friend, Scott Ackerson. Scott, the screen is open, but you don't have to use it. I just wanted you to know it was available to you. Scott and I served together at Haven for Hope, and I think at one point he tried to be my boss. I know there's a challenge that comes with that, but he did an excellent job, and we did some, I think, great work together. He has since gone on and intersected with other communities, and I'm going to stop there and let him tell the rest, like what's a social worker doing working at an architectural firm, and tell us about spaces that are recovery oriented. It's all yours, Scott.
All right. Well, thanks for the opportunity, Ann. And you didn't tell me Mark Wittig was going to be here, and I'm a little nervous. So those that don't know me, my name is Scott Ackerson. I'm a licensed master of social work. I've been practicing social work for over 30 years. Started my career in child welfare, worked in Minneapolis and Los Angeles for a number of years in residential treatment for children, then worked 10 years with young adults emancipating from foster care. Left there, went to work locally here at the children's shelter, and I was able to design the first trauma-informed care residential treatment center in San Antonio and perhaps in the state of Texas. So I was doing a lot of work in child welfare around trauma-informed care. At that time, I knew nothing about trauma-informed design, but we'll get there. So after the children's shelter, I went to Sam Ministries because I heard about this big project that was coming to town called Haven for Hope, and I knew Sam was going to be one of the primary partners. So I worked there 3 years while the campus was being constructed, and participated in some of the design with one of the primary architects there, James. Excuse me. So as soon as we moved to the campus, shortly thereafter, I was offered a position with Haven for Hope. So I accepted that position and oversaw the programs. And those of you that don't know Haven in the early days, the programming was horrific. It was very much behavior modification. And that's kind of what Ann referred to. We spent probably our first 3 to 4 years there really moving the programs into more evidence-based practice of trauma-informed care, recovery-oriented systems of care. We did an 18-month peer support integration project. So I really learned a lot during that time. I left Haven to become a consultant where I worked for a national healthcare consulting firm where I worked in the space of housing, healthcare, and the intersects with homelessness. Worked there a couple of years, and then a local organization, Prospera Community Housing and Community Services, hired me as a consultant and then asked me to go work there. I had served on the mayor's housing policy task force, and I really saw the writing on the wall for San Antonio. Having worked in other cities, I saw that the only thing that prevented us from having the same number of unsheltered homeless in San Antonio as the rest of the nation was the creation of Haven for Hope. And there's some federal policy things that go into that I won't go into. But while at Prospera, we had an opportunity to work with a local foundation. And we had talked about at Prospera, wouldn't it be cool if we started looking at affordable housing through a design, through trauma-informed design, and started looking at some of the standards and things like that. And so with Methodist Healthcare Ministries, Prosperamos Juntos, we had the opportunity to do a community project. And so we decided to do it around trauma-informed design for affordable housing. We had to recruit a faith-based organization to participate. So we recruited Merced. And then we also obviously needed somebody that knew design. So I got back in touch with James, who was now working for WestEast Design. So we worked together for a year on that project. And during that time, WestEast Design Studio decided to form what they call a social impact studio. And the way that the owners, Chris and Catherine Kim, tell it, the organization was 26 years old at that time, and they felt like 26 years old was time to mature, that they had built a business, but what had they done for the community? So they decided they wanted to start giving back to the community, and so they created the Social Impact Studio. Long and short of it, they recruited me to run the studio. I took the job my first day working at an architectural studio. I thought, what the hell am I going to do at an architectural studio? But I just had my 1 year anniversary, and we've actually started doing quite a lot. So the whole idea of the Social Impact Studio, I mean, it's several-fold. One, we're focused on human service endeavors, including emergency shelter, supportive housing options, transformational campuses like Haven. We're actually working on replicating campus in 3 different cities across the United States right now. We want to work with child advocacy centers, community centers, early childhood learning centers, and affordable housing communities. So we're really looking at these projects kind of full scale. So a different approach that we take is typically when architects design for others, the architects are kind of like artists where they design for what they like versus what the people like and the people need. And too often, people in poverty, people experiencing homelessness, don't have a voice, not only in their lives, but where they live, where they stay, and those types of things. So we really decided to try to reverse that equation. So now any of the jobs we do before we even put any pen to paper around design, we do a series of interviews, focus groups, and have conversations with what eventually is going to be the end user. For example, we're working with Merced Housing right now. They've got a property that has an affordable housing for seniors on it. There's some land next to it that they want to expand. So we've done focus groups with all the people living in the existing facility to help us to design the new facility. And we use that same approach across all the projects we do. So my team goes in, we do the pre-occupancy work around who the end user is and what the end user wants. Then we give recommendations to the architects, and the architects work those into the actual design. And then we've also got a researcher that does post-occupancy research. In architecture, that typically means that is the HVAC working? How is the lighting and things like that? This researcher looks at the impact of the occupant and the mental health of the occupant in the space. And has it improved their trauma? Has it improved their situation? Do they feel good about their living space? So instead of just creating places, we're trying to create healing spaces for people. And then we're testing it to see if it actually is working. And we take what we learn from that and replicate it in our next project. So some examples of work that we're doing, we're in Wichita, Kansas right now, working on a campus called One Rise, which is a behavioral health campus. There we'll have a combination of what we're calling a community care center, also known as emergency shelter. And one of the flags that we put in the sand is we will not do anything that has congregate shelter for people experiencing homelessness. Emerging evidence around the impact of congregate shelter on people experiencing homelessness is it exacerbates the problem, it doesn't help it. And so if we're really going to end homelessness, we have to do so by creating healing spaces so people can heal and rejoin community, and not put 400 people in a room together and expect that's going to be a healing environment. Also on the campus, we'll be developing affordable housing, permanent supportive housing. It's already been cited for the regional mental health hospital. We'll have an FQHC, federally qualified healthcare center, and a child care center. So really a welcome addition to that part of the community that's under-resourced in Wichita. An international project we're working on, and I see Anna Downey's on the call. So I've worked with IKEA a couple of years ago. They invited me out to Oakland for a co-creation session. They were interested in doing some social impact work. So we had some conversations about what that might look like. And over the course of several months, we started talking about homelessness and, how do we impact homelessness? Long and short of it, we did IKEA along with WestEast decided to design what we felt was and may well be the first trauma-informed tiny home in America. So as of May 1st, there will be a mock-up at the Live Oak store. The grand opening for the mock-up will be May 1st. We'll be bringing in people experiencing homelessness and people from Town Twin Village to walk through the mock-up, and then we'll be doing focus groups to get their feedback. The mock-up will also be available for anybody, any consumer at IKEA to walk through and also give us feedback. The original idea of this project was strictly for people experiencing homelessness, but there's some feeling that this type of product might be good for an ADU or something else. So I think IKEA is looking at potentially marketing it. So on or after May 1st, I encourage you to go take a look and please give me your thoughts and feedback on it. We're just starting some work in Okanogan County, the state of Washington. That's far northern Washington, very impoverished area, isolated rural area. And we're going to work with them on their 5-year housing and homeless plan. As I said, we're working with Merced locally to develop housing. We're doing a project in Baltimore around designing a community for primarily people of color, women that are single mothers, and really trying to help them kind of break economic barriers and create healthy community. We're starting work with the city of Dallas and some developers in Dallas to potentially replicate Haven for Hope. The same in Marin County, California. The same in San Francisco. All these areas with huge issues around homelessness. So that's kind of it, and in a nutshell, I'll leave it open for any thoughts or questions. Oh, and I didn't say that the tiny home, after we get the feedback from the mock-up, we're going to actually build the tiny home at Town Twin Village, and that's where we're going to do the post-occupancy testing. So Mark and Anna and team have been a great partner in this effort.
So
Scott, you
first,
mind if I ask
go
a
ahead.
question? Hi, Scott. When you talk trauma-informed design, what are the pillars? What are some of the insights, some of the things that are top of mind that set it apart from other designs?
So choice, there's different color patterns that have different impact on people. The lighting is important. The access to nature. So you don't go outside to necessarily an urban street and no trees and things like that. Water elements are always healing. So you create spaces that have good sight lines so people feel secure. As simple as locked windows, locked doors, and those types of things. So all of those types of components, and then certainly choice. So you look at affordable housing, and people say, well, it's expensive to do trauma-informed design. A trauma-informed one touch of trauma-informed design in affordable housing could be as simple as allowing the occupant to choose a color to paint an accent wall, to give them some control and some choice. But we too often don't give consumers that type of choice.
And I just want to kind of connect things as well, because Scott's a part of the Housing via Community Collaborative. That's part of our collective work here and has been participating in that. And you start to see now where the connections are happening, right? So that collaboration with Town Twin, and it's so exciting, Scott, to hear about all the places that the ripple effects are happening from the work that's happening here beyond us, but working with Town Twin and seeing that. And we're starting to see more examples then in congregational settings of, land that's available to facilities being refit in different ways. The thing that comes to my mind, Scott, is, okay, here's a challenge. If you were to go to Haven for Hope now, where they do congregant housing, how would you refit that to be more recovery oriented? We don't have to talk about that today, but that's certainly a question and a thing we need to be talking about, right? How would that look different as well? We did have somebody in chat ask about, where was it? Are you integrating donut economics into your projects? Do you know about donut economics?
I know nothing about donut economics.
Karen, why don't you tell us in a nutshell what donut economics is, because that might also stretch this model and this thinking and action. Karen, are you with us?
I am with you. Thanks for the question. And Scott, I am not an expert in economics, so let me just start by saying that. My understanding with donut economics is it questions the underlying motive of growth. Okay, so what growth are we looking for? Not growth of profit, so to speak, but like growth of well-being. So in the donut, you want to make sure that you are caring for the least in the world, kind of the Matthew 25 of the gospel, but then also having a consciousness in terms of environmental limits so that we are not adding to the degradation and the exploitation of our world and our resources.
So then, yes, Karen, we are doing donut economics. I just didn't know we were doing donut economics. So one of the principles of IKEA is sustainability. So this tiny home that we're designing is 100% sustainable down to the wooden nails that we will use to keep it together.
See, this is how much fun we are, Scott, on Thursday morning. We talk, recovery oriented with donuts. Where else do you get that in a conversation? I'm going to take a brief pause and give everybody a chance to also do some more thinking and questions for Scott. I just want to know when I can come to IKEA and see it. But we're going to pause. We make our compassionate respect response to everybody here that our briefing will be between 8 and 8:30. And so thank you, Scott. You brought a really nice briefing to us this morning. Next week, we're going to be hearing about another model coming into San Antonio that's a community organizing model that is led by young people, their voice and their organizing skill, and also their visioning for the future. And much like has been done with Bridges Together, with cohorts around the city in different geographies so that we're in proximity to the needs. There will be that similarity of being in different locations geographically, but reorganizing, re-envisioning community, and that will be led by 13 to 21-year-olds. So that's an exciting thing. We'll be hearing about that next week at the intersection. So if you need to leave, thanks for being with us this morning and hope you have great days. And now we're going to go back to today's briefing on recovery-oriented social impact within architectural settings. Do we have any questions, thoughts? Raise your hand, open your mic like Joseph did. They're quiet today. Don't know what to say about that, Scott. Where do you see things now from your perspective? Because you do have a long view, and I'm glad that you took time to tell your story at the beginning, because that's how all this works. Our stories intersect with each other and what we bring into that. So you do have a long view of San Antonio, those without permanent shelter in their life, now into housing. If you could voice from that long view a trajectory of what we need to be doing in San Antonio, kind of on a large scale, what would that sound like, Scott?
So there's the fallacy that homeless intervention ends homelessness. Homeless intervention does not end homelessness. Homeless intervention only ends homeless for those who have already become homeless. For us to truly end homelessness, we have to have the robust intervention systems, but we have to be doing a lot more work upstream. So the upstream interventions, access to affordable housing, mitigating issues of poverty, mitigating issues of historical oppression, institutionalized racism, and those more difficult things. So my long view is really about influencing not only local but federal policy. Another story. So as we're working on the Merced project, we're looking at funding that with what's called HUD 202 dollars, which is for affordable housing for seniors. And in the regs, it says that the projects must be modest, which in my mind is saying we don't want to make nice things for poor people. So we had designed porches for the units that they were going to design for Merced, and those are forbidden by the HUD regs. And we want to influence federal policy in the COC realm as well. and really look and take a critical look at housing first as the only intervention that's funded by HUD. So really the long term, and we really, that's partly why we're so excited about the partnership with IKEA, because you know, they've got international notoriety, and we really want to use that relationship to try to influence federal policy.
Mhm. So the folks too that are here at the intersection are faith, community, and civic leaders who are civically engaged, you know, trying to work with and throughout San Antonio, but very grassroots. What's the best thing that these folks could be doing in that bigger picture? Do you have thoughts about that?
Yeah, I think all the things we've been doing, but on steroids. I mean, it was the voices of the people that got us the housing bond. We need to keep making our voices heard and really understand these social issues, and not just accept at face value that that housing first is the only intervention for homelessness, but really critical thinking and then critical action, and really pushing our lawmakers to do the right thing and not do the easy thing or just the political thing. You know, too often we make decisions based on 2 and 4 year terms instead of really looking at what's for the good of the community. We really have to get out of that pattern and start thinking more long range and broadly about these social issues, and really pushing our, not only our political leaders, but business leaders and others to become a part of the solution.
Mhm. Yeah, it's our Achilles heel, I think, in San Antonio, are the 2 year terms and how that does influence the work. But we've been trying to counterbalance that, as you know, with community collaboratives, so that these collaboratives are running. It doesn't make any difference who's in office, really. You know, they're just running all the time, and working then with folks and entities within government structure who are in staff who are beyond the terms, but also with businesses and schools. We just need to be doing that, like you said, on steroids. Yeah, if there was some way to, you know, make that even stronger capacity, right?
Yep.
Capacity.
Uh,
Sonia.
Scott, what can someone as an individual with, you know, a close family, what can someone in this family setting do for what this effort for our homeless? I see a lot downtown as we're up and down. What can an individual do? I know we have access to collaboratives and organizations, and we connect leaders, but someone like me that with 3 college kids, 1 youngster, an elderly person, what can we do?
Oh, I learned long ago that programs don't change people, people change people. So what you can do as an individual, you can volunteer, and I would really encourage you not to just volunteer by serving food. I mean, all of that's important, but there used to be a program, and I think Anne ran that program, Soul Friends at Haven for Hope, and that was a program of lay clergy and others. And then when I taught at the lake, I had all my students would become soul friends. Their sole job was to go out to the courtyard and to engage people and to listen to them, and thoughtfully listen to them and engage them in relationship. The funny part of the story is at the beginning of the semester, and these were undergrads, they found out they had to go to the Haven for Hope campus. And the first day they walked on like they were going to catch a disease of homelessness because, oh my God, there's all these homeless people. By the end of the semester, they didn't want to leave because they formed those connections and relationships. That's how people change. And so that's what individuals can do. You can also, you know, oftentimes you're walking down the street, you'll say hi to people, but then we see somebody that's experiencing homelessness and we ignore them. People experiencing homelessness are people too, and sometimes something as little as a hello and an engagement can go a long way. Recognize the people's humanity.
Right, which kind of brings us full circle into the specialized navigation teams that we're trained to form. through this collaboration work to help congregational settings in particular to refit and reshape themselves, possibly into housing. It's not always the outcome. I put into chat about a congregational setting that's been refit into a school. But we are working at that process of highly skilled San Antonians that volunteer into teams that walk alongside a congregation who's thinking about reshaping, reforming, refitting their mission as well as their spaces. And so we asked a couple weeks ago at this setting for people who might be interested in the very first navigation team that we're putting together that goes into a congregation early on. And we've got some instruments now, some tools that we can use to do that. But people who are good listeners, people could be social workers, could be like real estate agents, people who have got some kind of knowledge of reshaping of space, but also of mission and strategy, but to walk with a congregation who's trying to explore what that might look like for them and then help them to discern that. And we've had one person step forward, and we'd like to see at least 3 people in a team. And then what this team does, it helps build capacity. It strengthens people like Scott and others who are working in this process so that we can be working with more congregations or more settings at the same time. We really believe that we're going to need maybe a half a dozen of those teams just doing that initial component to meet the future needs that we actually have today. There will be other teams that do other things like funding development. There's a team, there's a design team development, and then there's a wraparound sustainability team. We haven't even gotten to those. We're just trying to find folks out there who are committed to San Antonio and its healthy future and how we can strengthen that work together. So if you're interested in being on that team, just let me know and we're going to start connecting people. Sacred.org was developed by just such a team of highly skilled San Antonians who volunteered their life and skill sets into shifting San Antonio into a different way. So we can do this, and you can get to know Scott better because you get to work with him a little bit more. And he's a fun guy. He likes Bob Dylan, and he does yoga, so he's multifaceted. So he's a fun guy to be around. And I'm going to quit rambling. I'm hoping somebody has another comment, insight. Otherwise, we've really done our work today, Scott.
Oh,
Peter
Pete.
has a question, hand up. Go, Peter.
All right, thank you, Ann. Hey, Scott, great work. Thanks for the briefing. Really appreciate your perspective. I was on the 2020 Housing Bond Committee, and the permanent supportive housing and the wraparound service is something that we really focused in on, those supportive services. And I heard you mention Merced, and of course, great organization that you're partnered with. Question about the partnership, very targeted in that particular project, the plans for the outreach to the faith community there and how they could partner in that project. Just a thought on that, just trying to be very targeted in how we connect with different projects. And of course, I'm all in with your overall process of influencing policy, because I think that's much like what Ann just shared. I love that concept, Ann. I think that's so powerful to build the capacity and provide the resources directly. And plugging into a very practical project is always the best way, and piloting it out for others to model would be great.
Well, one of our greatest community resources right now, and I can say this out loud because I are one, but we've got this whole boomer generation who are retiring that have these amazing skill sets, and they don't go away when you retire. And to be able to put those to use, it's a large batch of humans that could be working together and recreating our community. with that critical thinking and the critical action that Scott was talking about earlier. It's strategy, it's intentionality. Any other last thoughts? All right, folks.
I
Thank
do.
you.
Sorry,
Oh, wait,
if it's okay.
it's
Um,
okay.
I was wondering if we're trying to advocate for this type of change, helping people most, prevention, that type of thing. How do you recommend responding to the hard line economic stance? It loses money. It's too costly. There's people who want to pay good money for good things. Why are we standing in the way of that?
So read the economic report that was done on the impact of Haven for Hope on the community. That economic report says for every dollar that this community has invested in Haven for Hope, we've seen a return of $29. So we look at economics only through one lens. We don't look at it through a lens of what are the cost diversions, what are the cost savings to the systems. And too often that we use that as the excuse to not build nice things. It drives me crazy that when we talk about a library or a museum, we never ever talk about, well, let's repurpose that building downtown for that. And when we, another true story, when we built the animal shelter here in San Antonio, I think we paid like $450 per square foot versus most homeless facilities are $200 to $250 per square foot. So we just, it's the forgotten people. We're investing oftentimes in the wrong things. And if we invest in the right things and invest in the people, we not only create healthy community, but we also create communities that are economically healthy.
And once you start shaping community, community starts healing itself. Those things that are higher up on Maslow's hierarchy, you know, when you're in relationship and you're near each other, you start to care for those things in different ways too, right? So we're working. And you got a clap there from David Davis. So thank you all for coming to Haven, look at me, coming to the intersection this morning. And it's another beautiful day out. We've had some rain. Let's see what happens with that. I hope you all have great weekends. And I look forward to seeing all of you next week at the intersection when we look at community organizing through the eyes and voice of young people. Thanks so much for being with us. See you next week.